Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about fracture in children. Well, we know that fracture is very common and for children it is more common, right? So let us see what is the definition of fracture. Now, the definition of fracture says that a fracture is defined as a breakage in the continuity of the bone. So whenever there is a continuity of a bone and there is a breakage in between that, we consider it as a fracture of bone. Now there is a particular pressure which the bone can tolerate. So when the pressure is greater than the bone can absorb, then fracture occurs. And we know that muscles, blood vessels, tendons, joints, there are several parts which are attached to a bone. So when there is a breakage of bone or when there is fracture, definitely there will be, these parts will also get injured. Now moving on to the common sites of fracture in children. So there are some common sites where we can see, mostly the children will have fracture in those sites. Well, the first one is forearm fractures. So this is the most common site of fracture in children. And then we have epiphyseal fracture. So this involves the physis, that is the growth plate. And then there is fracture of humerus. Now this occurs due to fall on an outstretched arm. And then there is femur fractures. This is very common in children. This involves the mid shaft of the femur. And this is usually found following a motor vehicle accident. And then there is tibial fracture. So tibial fracture is the most common type of fracture or lower extremity fracture we can say in children. So these were some of the common sites where we can see fracture in children. Now let us move to the bone healing and remodeling. So what we mean by bone healing and remodeling? Now when a fracture occurs, after that the bone has to, it has to recover, right? So there would be remodeling of that particular structure and the bone has to heal. Now we also know that the children are they are there in their growth and developmental age, right? So for each of the age group, the bone healing process and the remodeling process would be different. By this I mean to say that for each age group, the time which takes for the bone to heal or for the remodeling process would be different. So for neonatal period, it is usually 2 to 3 weeks. Then in later childhood, it takes around 6 to 8 weeks. And then for adolescents, it takes around 8 to 12 weeks. So based on their developmental age, we can, determine what will be the recovery phase or how long it will take for the bone to recover and for the bone to heal. Now moving on to the types of fracture. So we have different types of fracture based on, how the breakage is. So we know that if there is a breakage in the continuity of the bone, we call it as fracture. But what is the type of that breakage? So based on that, we have different types of fracture. Well, the first one is open fracture. Now, this is also called as compound fracture, and in this fracture, a wound through the adjacent or overlying soft tissues communicates with the site of the break. And then we have closed fracture, where the fracture does not cause any open wound in the skin. Next is plastic deformation or bending. So plastic deformation or bending of a bone occurs in such a manner where there would be, it would cause a microscopic fracture, or there would be a microscopic line in the bone. And this is only found in children. And then we have buccal fracture or torus fracture. So in this, the fracture occurs on the tension side of the bone near to the softer metaphyseal bone. And in this type of fracture, we can particularly see that the bone cortex is not broken, but it will be buckled. And then we have green stick fracture. So in green stick fracture, what happens? The bone is partially bent and it is partially broken. So as the name says, you can understand that how a green stick would, if you try to break a green stick, then how it would bend. Similarly, it happens in children, and that's the reason it is called as green stick fracture. And then there is complete fracture. So complete fracture means the bone is completely broken and any of the fragment is not connected to each other. The next one is depressed fracture. So here depressed fracture means the bone which is broken would be depressed. Now this is found in neonates if there is skull fracture. So what might happen, the part of the skull which is broken, which has been fractured, that would be depressed. So that is called as depressed fracture. Well, now moving on to the clinical manifestations of fracture. So in clinical manifestations, you can understand that if for example, if a bone is broken, in that case we cannot use that part, right? We would have a lot of pain or tenderness. We cannot use that part. So the first thing that would be there would be diminished function of that diminished functioning of that affected part. So the functional use would be affected. And then there will be presence of deformity. It can be visible or it can be palpable. Now it depends on the types of fracture what the child has gone through. So if it is an open fracture, in that case it would be visible. The deformity whatever would be present, it might be visible. And if it is not an open fracture, if it is a closed fracture, if it is not that severe, in that case we might it might be palpable. Other than this, there would be pain, tenderness would be present, and also there would be localized swelling and bruising. We can also see unusual mobility and shortening of the part where the fracture happened. And then apart from these things, there can be also muscular spasm. Well, now moving on to the diagnostic evaluation. So for diagnostic evaluation, firstly, we have to obtain the history from the parents. So we have to get to know that if there is any history of trauma, any history of injury, or if there is any history of chronic diseases, for example, osteomyelitis or carcinoma. So these things first we have to get to know, because this would tell us if the child is at risk for getting fracture. And then for clinical examination, for confirming what type of fracture it is, or how severe it is, to understand that, we can do radiologic examination. So for that we can do X-ray, MRI, CT scan, bone scan and fluoroscopy. Along with these things, you also have to make sure that the vascular assessment is done to confirm the diagnosis. So this was all about the diagnostic evaluation. Well, now moving on to the management part. So how a fracture can be managed? So the first thing is we have to immobilize the part. So for the bone to heal properly, we have to immobilize the part. We can do it by plaster cast or splint. Well, after that, there are several techniques to manage a fracture. So there can be closed reduction followed by immobilization. They can also do closed reduction and percutaneous spinning followed by a period of immobilization. And then there can be closed or open reduction and application of external fixators. Also, open reduction with or without internal fixation, and it should be followed by a period of immobilization. And apart from these things, traction also can be used. Now, there are some specific traction which is used only for children. So, here we have Briand's traction, which is specifically used for fracture of femur and if there is congenital dislocation of hip. And then there is Russell's traction. So Russell's traction is used for fracture of femur or hip, and it is also used for several types of knee injuries or contractures. Next is Buck's extension. So Buck's extension is used specifically for to prevent knee and hip contractures, and it is also used for if we want to immobilize a part temporarily. And then we have balanced suspension with Thomas splint and Pearson attachment. Now this is used in older children and adolescents in case of femur fractures. So this is to provide support to the to the fractured part or to the lower extremities. Next is skeletal traction. So skeletal traction is done in case of femur fracture, but it is done only when skin traction is contraindicated. Next is Dunlop's traction. So Dunlop's traction is used basically for if there is fracture of humerus and also for the fracture around the shoulder girdle. Then there is cervical traction. So cervical traction is basically used if there is spinal fractures or injuries. Well, next let us move to the complications of fracture. So the complications are infection. There can be avascular necrosis, vascular injuries or nerve injuries. There can be visceral injuries, tendon and joint injuries, fat embolism, compartment syndrome, and also shortening of the part where the fracture happened. Next, let us move to the nursing management. So in nursing management, first we will discuss about the nursing diagnosis. So in nursing diagnosis, definitely there would be acute pain. So you can understand, right? If there is breakage in the continuity of a bone and there is injury to the adjacent tissues, muscles, nerves, definitely the child is going to have pain. So there will be acute pain. There will be also impaired physical mobility. And then there would be risk for infection. In case of open fracture, there is opening in the skin, right? There would be an open wound which would be present in the skin, so that would increase the chance for infection. So there would be risk for infection. Now moving on to the nursing intervention. So in nursing interventions, the first thing we will do is wound management. So you have to start the wound management as early as possible to prevent infection of the wound. And then you also have to make sure that you elevate the extremity to reduce the edema. And then we have to check for signs of infection. So we have to continuously monitor the child. We have to assess the child if there is any signs of infection that should be ruled out at earliest and it should be treated at earliest. Well, so that was all about our today's topic. So let us conclude our today's topic here. So today we learned about fracture in children, and fracture means that breakage in the continuity of a bone. So we learned what are the different types of fracture and what are the common sites of fracture in children and how it can be managed. So I hope you have got a better insight about the topic. Thank you.